Following is a demonstration of the Posey roll belt. Remember, Posey roll belts are restraints. Posey roll belts are designed to allow the patient to roll from side to side in bed while ensuring the safety of a patient who should not ambulate without assistance, has a history of falling, or is at risk to fall if not assisted. Posey roll belts should not be used on patients who have ostomies or gastrostomy tubes, a history of hernias or chronic obstructive pulmonary disease, or abdominal or thoracic incisions. All patients in Posey roll belts must be monitored consistently and have the belt removed if the patient attempts to slide it over their head and chest to prevent accidental strangulation. To apply the Posey roll belt, lay the belt on the bed, soft side up, at the patient's waist level. Tie the short strap to a movable piece of the bed frame. Wrap the long strap around their waist and have them sit up and turn the strap through the slots in the back, and then tie the strap to a movable piece of the bed frame. Check to ensure the belt is not too tight by moving your hand underneath the belt without pressing on the patient's abdomen. Side rails must be used when using the roll belt. Do not use with the bed where the patient can move between the side rails and become suspended by the belt roll. Use side rail wedges to close gaps. Next, we will demonstrate application of the Posey crisscross vest. Posey crisscross vests are restraints. Posey crisscross vests should be used to ensure the safety of a patient who should not ambulate without assistance, has a history of falling, or is at high risk to fall if not assisted. Posey crisscross vests should not be used on patients who have ostomies or gastrostomy tubes, have a history of hernias or COPD, or abdominal or thoracic incisions. All patients in Posey crisscross vests must be monitored consistently and the belt removed if they attempt to slide it over their chest and head to prevent accidental strangulation. Never crisscross the straps behind the patient. This will allow the patient to rotate and loosen the straps to pull the vest over their head or attempt to crawl through the side rails, creating a strangulation hazard. Vests are available in different sizes based on body weight and chest size. Choose the correct size before applying by reading the label and comparing with the sizing chart information on the label. To apply the Posey crisscross vest to a patient sitting in a wheelchair, slide the patient's arm through the armholes with the opening in the front, pulling the left strap through the slot on the right side of the vest to crisscross the vest. Pull the bottom of the vest down to the patient's hips. Make sure the patient's hips are resting against the back of the chair to prevent them from sliding down. Tie the straps under the wheelchair so that the straps come across the hips at a 45-degree angle. Check that the patient is breathing comfortably and you can easily slide a hand between the vest and stomach of the patient. To apply the Posey crisscross vest to a patient in bed, slide the patient's arm through the armholes with the openings in front, pulling the left strap through the slot on the right side of the crisscross vest. Pull the bottom of the vest down to the patient's hips. Tie the strap to a movable part of the bed frame near the middle of the bed. Check that the patient is breathing comfortably and you can easily slide a hand between the vest and stomach of the patient. Side rails must be up when using a crisscross vest. Do not use with a bed where the patient can move between the side rails and become suspended by the vest. Use side rail wedges to close gaps. Finally, we will demonstrate application of Posey ED security cuffs. Posey ED security cuffs are restraints. Posey ED security cuffs are for extremely violent patients who are a threat to themselves or others. Posey ED security cuffs should not be used on extremities with dislocations or fractures, or open wounds or IV sites. To apply the Posey ED restraint cuffs, wrap the cuff around the wrist or ankle, pushing the tongue of the cuff through the buckle until you can only place one finger between the cuff and patient's skin. Push down on the buckle to lock the cuff. Attach a Posey connecting strap through the metal ring on the cuff and secure it to a movable part of the bed frame. Lock the connecting strap by pushing on the buckle and test by pulling on the buckle. To unlock the buckle, insert the key and turn counterclockwise. This concludes our review of Posey products. Please review this video or the manufacturer's directions prior to usage in the clinical setting.